Hello.
All right. Should I do a countdown or just start randomly?
It's up to you. We can always go back into the recording and edit it out.
Yeah. Okay. Hi, my name's Amy Vasquez. I'm a psych major and a third year at Cal State Long Beach.
And my name is Felix Militante. I am a fourth year at Cal State Long Beach in industrial design. And this is our presentation on skin cancer.
Skin skin cancer is the out of control growth of abnormal cells in the different parts of the epidermis. In more advanced skin cancer types, the cancer will grow through the membrane to the deeper layers of the skin, the dermis and the subcutis. Can you, Felix, show where sorry,
No,
where the epidermis is? Just go over it with the blue light. So it'll go from this layer of the epidermis all the way to the bottom of the subcutis, down by the yellow. Okay, next slide. There are 6 different types of skin cancers, in which some of them have different kinds of cancers within that main subject. The first one is melanoma skin cancer. It's less common than some other types of skin cancer, but it is more likely to grow and spread. Melanoma accounts for only about 1% of skin cancers, but causes a large majority of skin cancer deaths. 4 different types of melanoma skin cancers are superficial spreading melanoma, nodular melanoma, lentigo maligna melanoma, and arcal lentiginous melanoma. Superficial spreading melanoma are tumors that tend to grow outward on the surface of the skin. Some of these melanomas start in existing moles. Nodular melanomas are tumors often appear distinct, raised bumps on the skin that is often dark, brown, or black, but it can also be pink or red. This can make them hard to find early. They grow down into deeper layers of the skin fairly early, so they're often at a more advanced stage than superficial spreading melanomas by the time they are found. Lentigo maligna melanomas are types of melanoma that tend to occur in older people. It often first appears as an abnormally shaped tan or brown spot in an area that gets a lot of sun. Acral lentiginous melanomas are a type of melanoma that starts in areas that don't get a lot of sun exposure. It makes up a large portion of melanomas in people with darker skin tones. Basal cell carcinoma is the most common type of skin cancer. About 8 out of 10 skin cancers are a basal cell carcinoma. It usually develops on sun-exposed areas and tend to grow slowly. Lymphomas are really rare that start in the skin and are called skin lymphomas or cutaneous lymphomas. There are many types of skin lymphomas. Classifying them can be confusing even for many doctors because many of them are not very common. The main system used to classify skin lymphomas is from the World Health Organization, or WHO, which was last updated in 2016. It is based mainly upon whether the lymphoma starts in T lymphocytes, T cells, or B lymphocytes, B cells. How the lymphoma looks under the microscope, whether certain proteins are on the lymphoma cells, based on lab tests. Kaposi sarcoma usually appears as tumors on the skin or mucosal surfaces. There are 4 types: epidemic Kaposi sarcoma, classic Kaposi sarcoma, endemic Kaposi sarcoma, and laterogenic Kaposi sarcoma. Merkel cell carcinoma, less common, but one of the most dangerous. It starts in other parts of the skin, like inside the nose or esophagus. It's very common to spread to other parts of the body and can be very hard to treat if it spreads. It starts in other parts of the skin, like inside the mouth or in the esophagus. The squamous cell cancer is about 2 out of 10 skin cancers and are also called Bowen disease. It is the earliest form of squamous cell skin cancer and are still only in the epidermis and have not invaded into deeper layers. Squamous cell cancers can usually be removed completely or treated in other ways, although they're much more likely than basal cell cancers to grow into deeper layers of skin and spread into other parts of the body. We can go to the next slide.
Okie dokie.
Risk factors. BCC is the most common 8 out of 10 skin cancers. If left untreated, it can grow into nearby areas and invade the bone to other tissues through the skin, although it's very rare. If not removed completely, it can come back in the same place. People who have had basal skin cancers are more likely to get new ones in other places. Squamous cell carcinoma is kind of rare. It's 2 out of 10 skin cancers, usually can be removed completely, and is more likely than basal cell carcinomas to grow into deeper layers of the skin and spread to other parts of the body. Kaposi sarcoma, the abnormal cells can form purple, red, or brown blotches or tumors on the skin. These affected areas are called lesions. They can cause serious problems or even become life-threatening when the lesions are in the lungs, liver, or digestive tract. In the digestive tract, for example, it can cause bleeding, while tumors in the lungs may cause trouble breathing. Some risk factors with melanomas is exposures to ultralight UV rays is a major risk factor for most melanomas. Sunlight is the main source of UV rays. Tanning beds and sun lamps are also sources of UV rays. A mole, also known as nevus, is a benign, non-cancerous, pigmented tumor. Babies are not usually born with moles. They often begin to appear in children and young adults. Having many moles is also a risk factor. Most moles will never cause any problems, but someone who has many moles is more likely to develop melanoma. The risk of melanoma is much higher for people with lighter skin color than for people with darker skin. Other risk factors are family history of melanoma, having a weakened immune system, more at risk as you get older. Merkel cell carcinoma has also the same risk factors with UV light exposure, light color skin, being older. Also, being a male will make you 2 times more likely to receive any of the skin cancers and having a weakened immune system. Next slide.
Alrighty. So now we know what skin cancer is and the different types. I'm going to go over some of the symptoms and warning signs, how to catch the cancer before it's too late. So right here, I'm just going to go over the 3 main ones, the 3 most common ones, which is basal cell carcinoma, squamous cell carcinoma, and melanoma. So for basal cell, it normally occurs in areas like the face or the neck. So you're going to want to try and look for shiny skin colored bumps. These can be brown, black, or blue lesions as well, or flat, scaly patches. You also want to keep an eye out for any bleeding or scabbing. And then also, these things might heal, but then come back as well. And then, of course, any pain or itching. And the same is similar for squamous cell. You want to look out for any bumps. These are normally firm and normally the same color of the skin, or they can be flat sores with some scaly crust or scaly patches on the lips that could become some open sores, again, having that bleeding. Rough patches in the mouth, um, in case you get squamous cell carcinoma in the mouth, or any raised patches on the anus or genitals. And then, of course, any pain or bleeding. And then for melanoma, you want to keep an eye out for all of those moles that you have, any changes in growth of the moles or pigmentation or just general shape. Um, and then, of course, bleeding, pain, or itchiness. So if you don't catch this quickly enough and you need to get it treated, there are plenty of treatment options. However, it all depends on the depth of the cancer, the type, the size, and location. So we have a couple treatments over here. The first being freezing. A doctor can freeze off the cancer with liquid nitrogen, or you can opt for excisional surgery, which a doctor will remove the cancer along with a border of healthy skin by cutting it off. Or in places that it's important to conserve healthy skin, Mohs surgery is an option for that, where the cancer will be cut off layer by layer, preventing any loss of healthy skin in the area. So areas like the nose. Um, Curettage or electrodesiccation. Um, this is where a doctor will scrape away the cancer cells and then kill any remaining cells with an electric needle. Of course, you can go for radiation therapy, which is for any cancers that are grown above a size that can be frozen off or just surgically removed. This uses uh, high energy waves like X rays or yeah, just high energy waves to kill the cancer. And then, of course, chemotherapy uses a lot of chemicals that go throughout the system. This could also be used for lymphoma or any cancers inside of your body. And then the last one, which is pretty cool, is photodynamic therapy. So this kills cancer with lasers and drugs that will actually make the cancer spot sensitive to light. So finally, ideally, you don't really want to go through all those different operations. So how do you prevent all of these cancers from actually happening? Well, one, a lot of these cancers happen by being exposed to sunlight. So, of course, you want to be aware of the time you spend in the sun. Ideally, you want to seek shade whenever you have the option to. You want to use sunscreen whenever you can as well. Some companies recommend you put on SPF 15 or higher every day before going outside. Um, and then for newborns, who are exceptionally sensitive to sun. You want to keep them out of the harsh rays. And then, of course, just wear protective clothing. This can be long sleeves or hats, anything that keeps the sun off of your skin. And then one of the most dangerous things you can do is use indoor tanning beds. These are just pure UV light, and UV light is the main source of skin cancer. Also, avoid using like heat lamps or just any UV light sources. And then you want to go to the doctor, ideally monthly, but at least see a dermatologist once a year. You want to monitor and keep track of any moles that might be in the sun a lot, so any on your arms or any other areas that might be in the sun a lot. Look for the change of pigmentation, size, shape, anything like that. And of course, keep an eye out for pain, itchiness, or anything just strange. So that's a way to make sure you prevent any skin cancer. And that is our presentation.